Hello, everyone, and welcome today to our GAAPP webinar, Engaging with the World Health Organization. My name is Kristen Willard, and I am the Vice President of Education here at GAAPP. So we're so happy to have you here with us today. What I'll do to begin is to give you an overview of what you can expect and introduce our speakers, and also remind you, everyone who is on the line today should go to the bottom of your screen in order to choose your language. So you'll see a button that looks like a globe. You'll click on that. It says interpretation. You just click on that and it will, you want to click the language that you hear, or you want to hear in. Yes, Victor, I did. Okay, great. So let's get started. I want to welcome our speaker today, Erick Antonio Ochoa. He is a founding partner of Salud Justa, where he is currently director. Welcome. He has extensive experience in the legislative field. From 2003 to 2009, he was a parliamentary advisor in the 3rd and 4th legislature of the Legislative Assembly of the Federal District, currently Congress of Mexico City. Since 2010, he has been an activist and promoter of public policies to defend the exercise of the right to health. He received the 2023 Judy Wilkenfeld Award for International Excellence in Tobacco Control from Campaign for Tobacco-Free Kids. So congratulations on that. And thank you for all the work that you are doing. His advanced degree is in public policy, and we are lucky to have him sharing his expertise today. Thank you, Erick. Welcome. We will then hear from Tanya Winders. I think most of you know that she is our president and CEO here at GAAPP. She is president of our organization that represents more than 120 now patient organizations throughout the world. She has more than 20 years experience in leadership roles within allergy, asthma, and atopic conditions. She serves on several expert panels, including Precision and the ATS Public Advisory Roundtable. She's also on the board of directors of the American Respiratory Care Foundation. She's actually on travel now, so she will join us by video, and we are looking forward to that as well. So let's get started. Erick, what I will do is now pull up your slides and we will begin.
Good morning, and thank you for the invitation, GAAPP's invitation. I'm Erick Antonio Ochoa. Thank you, Kristen, for your introduction. I'm a director of Salud Justa. We are a civil organization in Mexico where we do policy advocacy and demands as well, lawsuits in what is public policies related to health. We work in advocacy for tobacco control. And recently, in the last years, we've also added new projects in universal health coverage, prohibition of trans fat of industrial production, and also in the control of the use of alcohol. I would like to thank for this presentation as well. I originally presented this in the Respiratory Network Allergy and Atopic Diseases, which is a network that gathers organizations that work in respiratory chronic diseases, both prevalent and rare, allergic conditions and atopic conditions as well. So thanks to this opportunity, I've been able to develop more concepts. You will be able to see them because I will leave the link here. This is a material we prepared in Salud Justa for to have some direct advocacy, and I think it will be very useful for all of you. I will now begin with my presentation. This is a policy brief about social participation in health that talks about participatory mechanisms between WHO, PAHO, and non-governmental entities. Firstly, I would like to begin with an initial note about the origin of the WHO. On October 24th, 1945, after World War II, 51 countries committed to maintaining international peace and security. This is the origin of the United Nations organization. One of the priority diplomatic issues when the UN was created was establishing a global organization dedicated to health. And this is how the WHO was born on April 7th, 1948, the date we celebrate every year as World Health Day. Since its origin, we've had basic principles established, such as the enjoyment of the highest level of health that can be achieved and the health of all peoples. Next slide, please. There are some initial topics I would like to cover regarding WHO. During the first 10 years, it focused on addressing post-war emergencies, as well as on the prevention and treatment of communicable diseases. And in the Americas, it focused on malnutrition, malaria, and paludism. Its global priorities were TB, venereal diseases, viral diseases, zoonosis, malaria, maternal and child nutrition, and hygiene, among others. Next slide, please. The PAHO is an organization that was created before the WHO. Its origins dates back to the first Health International Convention of the American Republics in Washington, D.C. This was on December 2 to 5th in 1902. So while the WHO is 75 years old, the PAHO turned 121 years last December. Next slide, please. We are now at a moment which is an epidemiological transition. We understand that this is not a unidirectional process that begins with infection diseases, and actually it ends when non-communicable diseases dominate the causes of death. Actually, this is a complex process where health and disease patterns of a society evolve in various ways as a result of demographic, socioeconomic, technological, cultural, environmental, and biological changes. Now, I would like to focus on the current concerns of the WHO and of the PAHO. As you might know, most people, 74% actually, of all deaths in the world are due to non-communicable diseases. Unlike the creation of the WHO, or even when we created before the PAHO, the greatest challenge at that moment were communicable diseases. Right now, it's non-communicable diseases, the greatest concern for government and for WHO and PAHO. Each year, 17 million people die because of a non-communicable disease, and 86% of these premature deaths occur in lower middle income countries. Here we should update the fact that between 2020 and 2021, mostly because of the SARS-CoV-2 pandemic we had around the world, we went to mortality rates that were at 2% to more than 10% in 2020, and from 7.5% in 2021. We know that most of these deaths of non-communicable diseases are preventable diseases and deaths, which are concentrated in lower middle income countries. By far, cardiovascular diseases represent the most prevalent. Even after the pandemic, cardiovascular diseases is still the most important one. We estimate around 17.9 million deaths each year, followed by cancer 9.3, chronic respiratory diseases 4.1 million deaths, and diabetes with 2 million deaths, including deaths due to diabetic nephropathy. in face of these risk factors, the WHO established the main risk factor as being tobacco, with 8.2 million deaths a year. From these 8.2 million deaths, 7 million are of direct consumption and 1.2 of people being exposed to secondhand smoke, mostly women, children, who not smoking directly, but because of being exposed to that smoke, they face different diseases and eventually death. The strategies for tobacco control are in the EMPOWER acronym. This is a toolkit that comes from the WHO framework agreement. This is an international agreement under the sponsor of the WHO. And given the importance of this risk factor and being the one that causes the most deaths around the world, since 2005, this treatment began. For alcohol, which is responsible for around 3 million deaths per year, WHO has implemented SAFER initiative, which is also an acronym that includes different policies and strategies for the intervention with the objective of reducing alcohol consumption. Another risk factor is sodium intake, responsible for 1.8 million deaths per year. And for that, we have the initiative called SHAKE. This is an initiative with the objective of reducing sodium intake. For trans fats, especially of industrial production, which is responsible for around, it says 500 deaths, but it should say 500,000 deaths. For this, we have replaced initiative, which is an initiative that tries to have prohibition policies to have a substitution of trans fat, of industrial fat production, for different types of fats, which are not that damaging for the heart. And for cardiovascular diseases, we have Heart's Global Initiative. This is also a very important initiative because, as we know, cardiovascular diseases are still the main cause of death around the world. Next slide, please. Regarding the burden of chronic respiratory diseases, here we have a slide that shows the burden of chronic respiratory diseases in Latin America for every 100,000 inhabitants. Here you can see the classification that includes most of the 35 countries that are part of the PAHO. And there are, let's say, different risks of chronic respiratory diseases per country. Unfortunately, in the first positions, we have Honduras, Argentina, Haiti, and in the last, Jamaica, Bahamas, and Trinidad and Tobago. Next slide, please. I would like to also refer to an initiative which was launched by the WHO. This was after the SARS-CoV-2 pandemic, and this is called PRET initiative. This is for the preparation and resilience in face of emergent health emergencies. It includes tools and approaches for shared learning regarding the pandemic and other public health emergencies as well. Let's now focus on the next part of the presentation, which are recommendations for relationships with the WHO and also the PAHO. In the case of the Americas, we have several recommendations, which are general recommendations. Firstly, we should not forget that the World Health Organization is made up of states parties. Currently, there are 194 countries which are state parties. The Constitution of the WHO recognizes that governments have responsibility for the health of their people. And the purpose of the WHO is to achieve for all people the highest possible level of health. Two of the essential functions of the WHO are to assist governments at their request to strengthen their health services and to provide adequate technical assistance. There are several different criteria, and many of them you will find them in relationship ways. We have in the framework for the collaboration with non-state agents. The last update is from 2020. Let's now go to some specific recommendations for non-state agents. Next slide, please. These recommendations are specific for non-state actors, and there are different classification criteria for these non-state actors. First of all, we have non-governmental organizations. Here we have, for example, Fair Health. These are, or Salud Justa, these are entities that act independently of governments. They do not have any primarily private, commercial, or lucrative purpose. We also have private sector entities. These are companies established with the purpose of providing benefits to their owners. We also have international business associations, which are private sector entities that are not strictly for profit, but represent the interests of their members, which are commercial companies and or national or other business associations. We also have philanthropic foundations. These are non-profit entities whose assets are contributed by donors, mainly foundations that make donations. And finally, we have academic institutions. All of these are within the general framework of collaboration with non-state actors. You will also see it in the Spanish reference in the presentation. Next slide, please. Within specific recommendations, the World Health Organization, in collaboration with non-state actors, supports the implementation of policies and recommendations of the organization formulated by its governing bodies, as well as the implementation and of WHO standards and technical regulations. There are also recommendations on the effective participation that requires the application of due diligence measures to clarify the interest and objectives of the entity, governance, financing, etc., and to have the maximum possible transparency. Any WHO collaboration with non-state actors is governed by the following general principles. A, demonstrate a clear benefit to public health. B, be in accordance with the Constitution, mandate, and general program of work of the WHO. C, respect the intergovernmental nature of WHO and the decision-making authority of member states. D, support and strengthen the evidence-based approach that underpins the World Health Organization's work. It's very important here that specific recommendations for collaboration with non-state agents have a respect for the WHO principles. There's a clear alignment with the objectives and priorities of the WHO and its regional entities, and also that collaboration should be based on scientific evidence. This is very important in order to justify the different collaborations, mainly in scope. We need to create indicators. We need to use scientific-based evidence free from conflicts of interest. This is also very important. What we expect at the end of the day is to have a relationship where the WHO has the maximum demands to use data that are verified and validated scientifically. Another recommendation, next slide, please. These are also specific recommendations for non-state agents. One of them is to protect the WHO against undue influence, particularly in processes relating to the formulation and implementation of policy standards and regulations. We should not compromise the integrity, independence, credibility, or reputation of the WHO. It should be managed effectively, in particular, avoiding conflicts of interest as much as possible. And they should be based on transparency, openness, inclusion, accountability, integrity, and mutual respect between the WHO, its regional entities, and non-state agents. Next slide, please. Regarding the participation, there are different mechanisms recognized for the interaction with non-state agents. These are meetings of deliberative bodies, which include meetings of the World Health Assembly, the Executive Board, and the 6 regional committees. Consultations, which include all face-to-face or virtual meetings organized to exchange information and opinions. Hearings, which are meetings where participants can present the data they have, opinions and positions, and they can be asked or questioned about it without entering into a debate. The greatest aspiration we have as a non-state agent, including a non-governmental association of civil society association, is to maintain official relationships with the World Health Organization and the PAHO. This is much more detailed in the document I shared. Unfortunately, we have it in Spanish, so we hope to have it in English as well. As soon as we do, I will share the document through GAAPP. Let's say that in these official relationships, there are several conditions, not just from the constitution of the civil organization or non-governmental organization, but also there are some processes in which throughout 2 years, we need to present some collaboration elements with the World Health Organization. And there is a validation we should also carry out every 3 years in order to show if these official relationships with the World Health Organization are maintained or not. Another condition is that in the agenda of these organizations, NGOs, there should be global concerns or regional concerns, at least regional concerns, for the interest at a national level to transcend. In my experience, even if as Salud Justa, we don't have official relationships with the WHO or the PAHO, we do have a very close collaboration with the PAHO, especially. They participate in some activities we carry out in order to discuss matters of public health, which are relevant for my country, which is Mexico. And we always need to be very careful, even in the way in which we ask for that intervention. This is a very specific recommendation I would like to give. Invitations for the WHO or regional offices should be made from state powers mainly. That is to say, if, for example, we want the PAHO to participate in a forum organized by the Senate of the Republic of my country, it is very important, it is essential that the invitation comes from a representative. This is not an invitation we provide directly. It is the authorities, the ones who make the formal invitation to the regional offices or to the WHO in order for this to make an intervention. And sometimes, even if we as a civil society organization would like to extend the invitation, what's recommended is for this invitation to come from the offices of legislators, ministries of health, from ministries of finance, if this is related with finance issues. And this is something which is very important for us to maintain. Even if there are topics related to legal processes, invitations should also come from the authorities, judges, magistrates, or ministries of the legal power, or from the Supreme Court of each country. These are my recommendations. Thank you very much, and I would answer any question you may have.
Thank you so much, Erick. That was fantastic. I know that's information that a lot of people probably did not have before. So we will open it up for questions. You can type your questions in the Q&A. First, what we will do is I'm going to give some context to something that you mentioned when you started, which was Serial. I see you cannot see me on camera. I apologize, which was Serial. So let me tell the group a little bit about what Serial is. So it's the Respiratory Allergy and Atopy Health Network, and Serial is, as it reads in its Spanish acronym. Serial brings together organizations working on chronic respiratory diseases, both prevalent and rare, allergic and atopic conditions, to explore the underlying connection and commonalities. So this network collaborates with patient advocacy groups in Latin America to provide the opportunity to work together, to network, and to expand their mission to cover more pathologies, and to develop a joint roadmap to work towards a common goal, which is improving the quality and life expectancy of patients in LATAM. And this includes generating public policies to ensure access to quality medications. So if you are on the line and you're interested in more information on that initiative specifically that he mentioned, which was Serial, please reach out to us at info@gaapp.org, and we'll make sure to connect you to that information. So thanks so much. What I will do, if you'll just bear with me, is now pull up the video that Tanya has shared with us for today's session. And so what she will be doing is telling you a little bit more about GAAPP's initiatives in this space and how you can become involved. So let me share my screen again. Okay.
The IRC is in several industry partners. And we have a aim in mind. That is to support the transformation of post-pandemic respiratory healthcare and to reduce death due to respiratory disease by 1/3 globally by 2030. We've been discussing a WHA resolution that may be introduced in 2025. However, there has been some debate about should that be focused solely on access to essential medications or be broader to encompass all lung health and respiratory disease. So stay tuned, but it looks like that will be a 2025 initiative. And then also we have been working on journey mapping. This is an effort that we have undertaken with 6 asthma organizations and 6 COPD organizations to better understand what is the lived experience.
I'm just stopping that because I understand that you could not hear the audio, and that cannot help at all. So let me, I have it up as high as it can go, but what I want to do is try again. So let me stop sharing, and I will share again so that we can try to do this properly. I do not want you to miss out because this is a good video for you to hear. Okay, let's try again. Okay, let me know if you can hear it. Let's try.
Hi everyone, it's great to be with you today. I want to start out by talking about some of the GAAPP advocacy highlights and the work that we've been involved with. First up is the International Respiratory Coalition. The IRC is a multi-stakeholder group that is led by the European Respiratory Society, ERS, alongside GAAPP as the global patient voice and several industry partners. And we have a single aim in mind, that is to support the transformation of post-pandemic respiratory healthcare and to reduce deaths due to respiratory disease by 1/3 globally by 2030. We've been discussing a WHA resolution that may be introduced in 2025. However, there has been some debate about should that be focused solely on access to essential medications or be broader to encompass all lung health and respiratory disease. So stay tuned, but it looks like that will be a 2025 initiative. And then also we have been working on journey mapping. This is an effort that we have undertaken with 6 asthma organizations and 6 COPD organizations to better understand what is the lived experience of patients living with chronic respiratory disease across various regions throughout the world. We'll be taking a look at those journey maps, identifying where there are common themes and barriers as well as opportunities, and working that all into the WHA resolution. Then next is the WHO GAARD, the Global Alliance Against Chronic Respiratory Disease. I am serving on the GAARD steering committee as the patient advocacy voice, and GAARD members across the board are non-acting state members to WHO who work together to accelerate progress towards the UN SDGs, the Sustainable Development Goals. And we're actually working on a number of policy position statements for air quality, tobacco, access to innovation, access to quality care, and affordable health care for all that will all be part of our advocacy toolkit. This will launch in May of 2024, and we're excited to share it with you because it will be a model policy position statement that each of our member organizations can then take forward and adapt as needed to your in-country needs. Now to talk a bit more about the IRC for just a moment. The International Respiratory Coalition, as I said, is ERS-led. GAAPP is one of the key partners alongside several industry partners. And the overall goal meaning to really transform post-pandemic respiratory care and reduce mortality by up to 1/3 by 2030. We are doing this by national coalitions, and now there are 15 national coalitions that actually highlight 4 areas of focus. The first is prevention of respiratory disease. The second, access to the right treatment at the right time. Third, action on reducing health inequalities. And fourth, prioritization of research, data, and insights to improve care. The IRC manifesto can be found at our website as well as at the International Respiratory Coalition's website. And again, each of these national coalitions has been charged with having a patient advocacy participant in that coalition. So please go to learn more, find out how you can get involved in your national coalitions. And if you don't see your country represented, definitely come forward if you want to work in collaboration on a national coalition to advance respiratory care. The next area that I want to speak to is our Speak Up for COPD campaign. This campaign is in its 3rd year. It is a coalition, again, that is GAAPP-led, but also has multiple nonprofit partners and industry partners who are agreeing annually to speak up for COPD, to elevate COPD as the public health priority that it should be with governments. And so we have developed a number of different tools and assets that are available at the Speak Up for COPD website that you can use with your own in-country efforts to elevate COPD as a policy priority. We also have a sample COPD policy dossier that can be used with government and HTA bodies to help better lay out the case for why COPD should be that public health priority. And there'll be additional assets that will be forthcoming this year under the Speak Up for COPD campaign and coalition. We will have the State of COPD report in September and the COPD index in October that will compare country to country on different policies and opportunities to get involved in elevating COPD as a public health priority. So remember, now is the time to take action. There are many ways that you as member organizations can get more involved in the advocacy work that we're doing at GAAPP, whether it be through our participation in the IRC, the Speak Up campaign, and or through the GUARD activity. There's a number of ways that you can have your voice heard, that you can be more engaged in the advocacy efforts at the global level.
Excellent. So I will stop my share. We are back on camera now. I hope that people can see us. And I want to thank Tanya for that presentation because I think that's extremely helpful. Erick, so we have time for some questions, and I will ask people to add those to the Q&A if they have any questions to ask. But will start because I had a few while you were speaking during your excellent presentation. So one of the things I wanted to know, we know no matter what condition we represent, right, that there's considerable overlap, let's say. There are many comorbidities for many of our conditions. So when you were talking about those non-communicable diseases or deaths earlier, I could see that many of those are related. Do you recommend that organizations band together across conditions in order to have more of a presence in advocacy with organizations like the WHO?
Yes, in our case, in Salud Justa, many times the interactions we have is through coalitions. And in the case of Salud Justa, for example, we have a coalition for non-communicable diseases, which is the Mexico Healthy Coalition. And this helps a lot to have a greater attraction on public topics on which we want to work in this relationship we can have with PAHO or even with the WHO. It is very important that we have the presentation of coalitions to also express interests that are similar to the agendas of the WHO and of the regional offices as well. I think that will be much more attractive to use. Even indicators we may also use, or the WHO may use, to refer to policies recommended depending on the level of affectation to health on which we want to focus. I think that is also very relevant.
That's very helpful. It's good to know the effect we can have when we all band together, whether we're just within our condition, right, or across conditions, the impact we can make. Another question that I had, I thought it was interesting when you were talking about the necessity for communications to come from a formal level, right? So whether it be at the regional level or the national level or your state level, wherever you live, that it should come from a state power, someone in power. And I wondered about that. If I was a patient advocacy organization and we had an article or a policy brief that we wanted to get into the hands of people that were of influence and importance, and I had no idea where to start, can you tell us a little bit about how I would figure that out?
Thank you, Kristen. This is a very interesting question. When we want to approach a public problem, we look for allies in Congress, even before looking for allies in the national government. We go to congressmen who help us. They have helped us create forums, debate tables, where they, as congressmen, congresspeople, can convene other representatives of international organizations, such as the PAHO in the region. And that helps a lot in order to have constructive dialogues, even in order to suggest specific initiatives that will modify laws or plans, programs, budgets. This is a pathway that has given us very good results. Let's say that it's the historical pathway we followed as an organization. When we have a good relationship with ministries of health, that's also another possibility. But sometimes countries don't necessarily have a political will or the support of representatives of ministries of health, finance ministry, or budget ministries. And so in those cases, we need to try to look for our best allies that are representatives of a state body for that to work.
Excellent. That's very helpful. I think then that sort of advice gives people a clear path if they are sitting in a small office or at their kitchen table doing this work, right? If they're not part of a large influential organization. So I appreciating you letting us know that it's possible, right? No matter your size, to make those connections and to affect change. I think that makes people feel empowered. So thank you, Erick. I see Victor has his hand up. He has a question.
Yeah. So, well, first of all, thank you, Erick, very much. I think it was a great presentation and something was very long overdue at GAAPP to have this information ready for our members. So my question is more like a comment. As you know, we do have a mandate in WHO for diabetes, but we do not have a mandate for chronic respiratory diseases, even though they are the third cause of death in the world. Do you think even though we, as Tonya said, we are working on it, but it's now the year 2022 and we still don't have it. So do you know why this could happen?
Thank you, Victor, very much. And thank you for the invitation as well. I would not be here if you hadn't invited me. Generally, in the World Health Assembly discussions, I think it's necessary to discuss more about chronic respiratory diseases. Unlike other conditions, such as cardiovascular diseases or other type of diseases, I think that we need to strengthen interventions in world assemblies and regional assemblies. And that is not just for one entity or coalition, as could be GAAPP, but we need to add will from different countries and ask to the ministries to have those discussions in world and regional assemblies. Because I think it's there where we can get the idea of the different problems we could have, for example, in chronic respiratory diseases, but also of alternate solutions, and to have mandates for governments to establish policies, budgets, plans, programs which are specific for these conditions. I think that unfortunately, I see that sometimes we know this is one of the most important causes of death, and it does not have the attention needed. I think that that also has to do with the lobby of the governments, but also in this opportunity we have right now as organizations of the civil society to pressure up for governments to pay attention to these conditions and to take them to deliberations of international organizations such as the World Health Organization. I think that's also very important.
That is great, and I totally agree. I think it is so important that we all work in our countries to have a plan for the management of chronic respiratory diseases, and for that to be mirrored or transferred to WHO. So maybe one day we all have the same plan. So thank you very much for confirming that we are in the right track.
Thanks, Victor. Let me ask if there are any questions from our audience before we move on. Okay. Well, in closing, I just want to say thank you so much, Erick. That was absolutely fantastic. We look forward to your brief in English when you're ready with that. That's fantastic. And we'll make sure that this is available to people in Spanish now. I want to thank you for the wonderful presentation and for getting up early in Mexico for us. I see day has dawned, but when he got on the phone, it was quite early for him. So we appreciate you being here with us. Victor, thank you as well. Thank you to our interpretation support. Thank you to Tanya for joining by video, and thank you to all of you for being here with us today. If you have any questions for us, you can contact us at info@gaap.org, excuse me. And you can also view this. It will be posted on our GAAPP Academy page on the gaap.org website. So thank you again. I wish everyone a wonderful day.
Thank you, everyone.